Hello, and welcome to our video training series on Light Curing Excellence by Bluelight. My name is Madison Law, and I'm excited to share our passion for clinical excellence with you today. At Bluelight, we are passionate about helping our customers provide excellent restorative outcomes. I'm the Customer Success Manager here at Bluelight, and I love to help provide education and guidance for the dental community surrounding all things light curing. You may be wondering, what are we going to be talking about regarding light curing that you don't already know? And better yet, who is blue light? We've done a considerable amount of research in all aspects of light curing, from material science to clinical application to education. We've learned that to date, there isn't a lot of technical training regarding the light curing process. Good news, this is where Blue Light Analytics comes in. Blue Light was founded out of Dalhousie University in Nova Scotia, Canada in 2009. Since then, we have been at the forefront of light measurement technology, using our expertise to improve clinical and business outcomes for dentists, DSOs, and manufacturers around the world. Have you ever thought about this fact? Restorative dentistry is driven by blue light. Did you know that over 50% of revenue in a dental practice involves curing light procedures, and up to 8% of restorative billings are lost due to practice and operator factors every year? Everything you do in the practice that is a repeatable procedure should have a system, but many practices currently do not have a system set up for light curing. The light curing unit has become an essential piece of equipment in the dental office, but few dental practices regularly monitor the output from their light curing unit. But now you can change this at your practice, because when we know better, we can do better. What do you remember being taught about light curing? Not much? Is your curing light working properly? Do you plug it in, turn it on, push the button, and think that it's working? The problem is that you can't always see when it's working as expected. Are your restorative materials matched to your curing light and being properly cured? There are over 800 models of lights and 1,000 different light cured materials. Each material has different energy requirements for proper curing. We've learned that only about 40% of dental assistants receive proper training in light curing operations, and yet they often test and operate curing lights regularly. What happens in your practice when you have a dental assistant that goes on maternity leave? Have new dentists join the team? Are students working in your practice in co-op placement? How are they trained? We also learned that 25% of curing lights aren't working as expected in dental practices. International standards for curing lights state that the light output should be within 20% of the manufacturer's stated output. How would you know if you're not evaluating your curing lights on a regular basis? Lastly, we know that 66% of light operators are likely to undercure posterior restorations because of improper technique, which is simply due to lack of available training. This is a very high percentage and something that could easily be fixed. Many dental practices do not have a system in place for ensuring that best practices for light curing are followed, like regularly testing their curing lights. Not having a system in place can have an impact on patient care and outcomes, and we'll now discuss some of these impacts. Did you know that post-operative pain or sensitivity can be caused by improper light curing? What is the risk to your patients? Do you have patients concerned with post-op sensitivity? Some of the main reasons for this include uncured composite and deep restorations, pulp damage from excessive heat, or partially debonded material causing microleakage and recurrent decay. Treatment for these issues can include composite replacements, endodontic treatments, root canals, and crowns. So, you may want to ask yourself, wouldn't it be great if these issues could happen less often or not at all? Over the years, curing lights have become way more powerful and can cure materials much faster. However, more power equals more heat. Curing lights can cause pulp and gingival damage by overheating the soft tissue. This usually occurs when high-powered lights are used for too much time, the restoration is located near the gingiva, or the pulp is vulnerable because there's little dentin protecting it. Another impact on our patients happens when materials are undercured, meaning that they do not get enough light energy. Do you have many redo procedures in your practice? Have you ever thought that redos could come from your curing unit and technique? This takes up valuable chair time for the dentist and costs the practice money. Undercuring symptoms can include debonding, discoloration, and composite fracture. These can happen when curing times are too short, light outputs are too low, operators are insufficiently trained, or a light's design makes it very difficult to position intraorally. I'm not sure if you've ever really thought about this in your practice, but tip design matters. You want to have a good overlap between the light tip and the restoration area, and a low profile tip that will help reduce technique sensitivity. So, on the bottom left, you see an 8 mm tip, a 10 mm tip, and a 12 mm tip. The smaller the tip, the more difficult it is to cover the restoration area with the tip. This means that how the tip is positioned, which relies on operator technique, is very important for smaller tips. If the light tip is not directly over the material will not fully cure. It's like trying to boil a large pot of water on a small burner. Only the area directly over the burner gets much heat energy. For this reason, large tips that can easily cover the restoration area are less sensitive to positioning and the operator's technique. Like the tip size, the design of the tip angle can determine how challenging it is to reach posterior restorations. When you look over on the right side of the screen, you'll see examples of different tip angles. You'll see at the top of the screen that A and B have high angles. With high angle, it's difficult to position the entire tip very close to a filling at the back of the mouth. Because of this, some parts of the composite filling may not get enough light energy. However, low profile light tips, like the ones shown in E and F, are much easier to position. So, do you have the same curing lights throughout your practice, or do they differ in aspects like tip size and angle? This would be a good task for you to look at because differences in light design may require you to adjust your light curing technique to ensure that the materials are fully cured. Thank you so much for joining me in completing Module 1. I will see you all in Module 2.